So welcome everybody one more time. For those who connected, you already know that today we will be speaking about ISCRAM, how to bridge the research with the public safety, challenges, issues, emergencies. So here, if we can move to the next slide, my name is Kasia Kotz, I'm EENA's events manager, and today I will be accompanied by a numerous circle of panelists, ISCRAM representatives, the three main ones that we have on the slide, but with others as well. So bravo, thank you very much for being with us today. We will start the presentation after I run through some practicalities. If we can move to the next slide. So today, what we will learn about ISCRAM, all about it, and of course, how to find the opportunities, well, between the government and the industry practitioners to collaborate with researchers on emerging public safety challenges and opportunities. You as participants, you have possibility to ask, of course, the questions. Please use the window of the chat or Q&A to ask your questions. They can be anonymous. You don't have to state your name, but of course, the moderator from ISCRAM, Rob, who is with us today, will pick up on some questions at the end of the webinar when we will have the Q&A session. So what about the post-webinar materials? Tomorrow, everything will be on our webpage. So the recording of this webinar together with the slides that we will show presented today will be on our webpage. So that's all from me. Now I will give the floor to Rob, who will present you the ISCRAM.
Thank you, Kasia. And so I'd first like to thank our EENA hosts for inviting ISCRAM to present today. And we will get started. I see the slides appearing now. So my name is Rob Grace. I'm an assistant professor at Texas Tech University. I'm joined by my colleagues, Caroline Riga and Anouk Edro, from who are the president and secretary of ISCRAM, respectively. And today we'll talk about what is ISCRAM and how we can forge connections between researchers, industry, and government practitioners in the public safety communication space. As you'll see in the outline, we'll start by introducing ISCRAM to talk about what this association is and what it does. We'll move, I see us moving through points 1 and 2 more quickly. We'll introduce, the organization, but then we'll focus on our third point, the research showcase, because I'm happy that we're joined today by three researchers who are part of our ISCRAM community. And they will be presenting on different aspects of research performed by members of ISCRAM. And they will invite your questions, and I look forward to seeing the diverse work that goes on at ISCRAM. Finally, we'll talk about how EENA members can access ISCRAM research. We publish our research in our open access library, and we will introduce that and discuss what you can find there. And lastly, we will talk about opportunities for collaboration between ISCRAM and EENA members. And there are a few ways, and we'll discuss those. Next slide, please. So first, what is ISCRAM? ISCRAM stands for Information Systems for Crisis Response and Management. Next slide, please. So this is a broad, our name indicates the broad scope of the research that members of ISCRAM do. So first, they focus on the design, use, and evaluation of information and communication technologies in a crisis response and management context. Next slide, please. And so ISCRAM researchers look at kind of the broad scope of emergency management, from preparedness to mitigation, response, and recovery. So public safety is an important but one part of this broader research agenda that it comes into view when, say, you come to the ISCRAM conference and see the many presentations that range from public safety communications to issues of humanitarian logistics surrounding large-scale disasters. Next slide, please. Okay, so ISCRAM is an active community of researchers, but they come from different places. Academia, they come from industry, and different government agencies that interact with academic and industry researchers. The goal of the association is to, foster knowledge, or and specifically to encourage collaboration on applied problems of emergency and disaster management that relate to information systems. The important question of how do you pronounce ISCRAM? Is it ISCRAM or ISCRAM? There's a clear answer to this. No one knows. So if you're wondering, it doesn't matter. You can take your pick and you'll be fine. Okay, next slide, please. Yes, so to my previous points, ISCRAM is a community of researchers, and its goal is to foster knowledge and encourage collaborations that produce insight into these applied problems. Next slide, please. Okay, ISCRAM began as a workshop in Brussels in 2004. We have 3 founders, and it's gradually expanded since that time. 2009, it was founded as a nonprofit, which it continues to this day. Next slide, please. So what does ISCRAM do? And you'll see the growth of the association in these next slides. Next slide, please. Basically, our work revolves around the annual conferences that ISCRAM coordinates. In the past, we have had summer school events for graduate students working on issues of related to information systems and crisis response and management. And as EENA members, EENA has done, we've also had a series of webinars over the pandemic. Without being able to meet, we've had kept our community active, introducing new topics and new research that emerged during the last 2 years. And finally, we publish our research and make it available to other researchers, but as well as to other communities, other interested parties who might find interest or benefit in using it. Next slide, please. So our work really revolves around our annual conference, which you'll see from 2004 has taken place every year and alternates between Europe and the Americas. I'm happy to have Chris Zobel here. He was last year's organizer of our virtual conference from Virginia Tech in Blacksburg, United States. And our upcoming conference is in Tarbes, France, in this May. And I'll talk more about that at the end of the presentation. There's an interesting opportunity for practitioners and researchers to hold some joint sessions and submit a practitioner paper. We'll get to that later. But our conferences are, in some ways, resemble the EENA conferences. We have demos, workshops, and then we have different panel and paper sessions that introduce the research that our community is doing and engage in discussion and launch new projects. out of the conference. We also have social events. I always look forward to our Sunday beer event. That's has been our traditional Sunday afternoon activity. All right, next slide, please. So there's affiliated ISCRAM events that recognize the regional work among researchers on these topics. So we've had ISCRAM Med, ISCRAM events in Asia, and ISCRAM Asia Pacific. I'll note that the upcoming Asia Pacific for 2022 was originally scheduled for 2020. However, due to the ongoing pandemic, it's been postponed, but we look forward to hosting that in Australia at the end of the year. Next slide, please. So ISCRAM, it's important that ISCRAM supports not only active scholars, but students and PhD students and early researchers who are entering the research space on these topics. And so ISCRAM has held various summer schools events to support their work. Next slide, please. As I mentioned, we were unable to have our 2020 conference, and then we had our 2021 conference virtually. So to keep the community active, we've ran a series of webinars related to the challenges that have accompanied the pandemic, drawing on the expertise within the community. You'll see some of the topics listed here, as well as the presenters. So we envision this webinar series as a kind of a temporary stopgap for the pandemic, and it's been a useful way to share research, encourage collaboration, accomplish the goals of the community without meeting in person at our annual conference. Next slide, please. Lastly, ISCRAM focuses on publishing and making available its research. The primary way we do that is through the ISCRAM Digital Library. I'll discuss that further at the end of the presentation. But we've also had a journal dedicated to ISCRAM work, and our conference proceedings and other literature are made available and indexed in different academic databases. Next slide, please. Okay, so this, I ran through kind of who we are and what we do, but now is the more interesting part. So we have 3 researchers who will discuss 3 different projects. And they give just a window into the types of research that goes on in the ISCRAM community. Next slide, please. So there are many researchers who work on issues related to public safety. These range from simulations of emergency response, emergency dispatch, to investigations into command and control, critical infrastructures, GIS systems, as well as early warning and new emerging and alternative communications channels that are relevant to public safety practitioners, public safety communications. I'm just suggesting that there's a broad range of research. We're going to look at now 3 particular projects that are worked on by our 3 presenters today. So next slide, please. With that, I will turn it over to our first presenter, hopefully Moran. I leave it to you.
So hello everyone. So today I'm going to present you a workshop simulation we made to test a CPR demonstration video with bystander. So first I'm gonna give you a little context. So out of hospital cardiac arrest have a very low survival rate, and it's improved by doing early CPR and early defibrillation. But bystander doesn't want to do CPR and even less defibrillation because they fear of hurting the victim and the lack of CPR knowledge. In addition, health professionals show mistrust when dealing with bystander, and the lack of previous collaboration leads to frustration and misunderstanding in both sides. So we ask ourselves how to improve the rate of bystander CPR and its quality. We can do it by developing digital application for witnesses that allows to send videos of first aid action. An experimental study shows that that increase the number of CPR performed and its quality by improving the rhythm, the compression, interruption, and hand position. We can also do it by building trust within the survival chain by sharing common experience that builds confidence. Because it's enable knowledge transfer, building a shared discourse, and bringing out a collective framework. So we will do shared simulation with an application for witnesses. So we use SARA application, which allows any witness calling an emergency number to be connected to the regulation center and provides first aid demonstrations sent by the dispatcher. The protocol we made was 5 simulations at HUG hospital with 6 citizens, 2 dispatchers, 5 first responders, and 6 paramedics. The scenario we used was: you have found in a park an unconscious man of 60 years old, you call 144 and follow the instruction given by the dispatcher. And the course of action was the participants finds the victim and calls 144. The dispatcher completes the assessment and on recognition of the RCA transmits the SARA video CPR. The participant starts CPR following the video until first responder save a life and paramedics arrive. And then they will share a debriefing, a shared debriefing. We analyze the video effect on cardiac massage. So 5 participants expressed that the video was a help, a good input, a stimulation. They help them get a better hand position, as you see in this picture, and to keep a good rhythm. The video helps reassure the bystander. It adds something comforting, and the dispatcher, the witness watching the video, will do a rather effective massage, and this is probably what will save the patient. We also analyze the effect of simulation on the relationships between stakeholders, and we saw a confirmation that the witness is perceived as an essential and as a resource instead of a burden. He is viewed as a relay for massage. It doesn't matter how good the massage is, there is a massage that is given. I have other skills and I will arrive and let the person do the massage, say a first responder. And as a liaison with 144, to have someone in contact with the dispatch center until the paramedics arrive, it helps psychologically. It is also an opportunity to explain processes to avoid confusion and frustration. Thank you.
I'll ask one question. You used the SARA app. Through the research, did you have any kind of implications for the design of the app or for the design of similar apps that help coordinate bystander intervention?
Yes, we saw that when we have made interviews, and we saw there was an interest with feedback video for the dispatcher. And so I think the app will get better if we implement this feedback in the Sarah app or another app.
Okay, thank you very much. Thank you, Mary. I introduced ISCRAM as concerned with the design, use, and evaluation of information and communication technologies. I think Julie's project is a very good example of evaluating and testing the use of an information system, but also through applied projects that bring together practitioners and researchers on these types of issues. So now, as you'll see, we have our second presenter, Dr. Marion Tan. She is from Massey University in New Zealand. Due to the time difference, she's unable to present. However, she did forward a pre-recorded video, which we will play now.
Kia ora, everyone. Hello from New Zealand. I'm Dr. Marion Tan, and I'll just share a little bit about our project on exploring the feasibility of an earthquake early warning system in New Zealand. So I'm presenting this on behalf of my colleagues and project team. So first, what is an earthquake early warning system? So basically, earthquake early warning is just really warning people a few seconds beforehand before ground shaking starts. The basic principle here is that the communication information can travel faster than earth movement. So when an earth movement is detected at one sensor, we can send information really, really fast to a population center before the ground motion arrives. So earthquake early warning exists already in different parts of the world. So you probably hear about it in Japan, Mexico, West Coast, United States. So it's already existing, but in New Zealand, we are still at the feasibility stage. And since we're still exploring whether earthquake early warning is possible, we are adapting a design science approach. First, we already know that there are foundations that have been established in literature and in science. So we have to make sure that whatever we build has a strong knowledge base. But at the same time, we have to make sure that it applies in the domain of New Zealand, that it's usable for New Zealand public and New Zealand users. So we have to make sure that whatever we design is aligned with the community and the infrastructure here in New Zealand. So New Zealand is quite interesting because it's quite a seismically active country, but it also has a really small population. So the question is, do we invest a lot of money into building infrastructure for earthquake early warning New Zealand? Is it cost effective? So our team, we're trying to investigate whether it is possible to design a low cost solution for earthquake early warning in New Zealand. And we are trying to explore this using a design science approach. So what are we doing? First, on the technical front, we're trying to explore an experimental earthquake early warning network using low-cost sensors. So these are small sensors that can be established in different homes or institutions, and they're relatively cheaper than high-end sensors, seismometers. And we're trying to establish it in Wellington region and using edge computing. So we're currently running an experimental network for this one. But at the same time, like I told you, aside from the technical front, the rigorous science on earthquake early warning, we also want to make sure that whatever we build will be usable for the social community side. So we have, as part of our project, we've also established a community of practice for earthquake early warning in New Zealand, meaning we're creating a group of people that come together to discuss how to move forward in earthquake early warning in New Zealand. But at the same time, we're going to communities as well. We're doing workshops to understand how do people think about earthquake early warning. This is a totally new concept to a lot of people. So we're trying to have these conversations among our communities to see whether what's the perception and how people would think it be useful or not to their community. So, so far we've engaged with 8 communities in New Zealand, and we've done this using a comfort board approach, a quite innovative style of talking about different issues and concerns people may have on earthquake early warning. So this is just a glimpse of what we're doing. So if you are interested in what we're doing, please feel free to contact me, Marian Tan, from Massey University, or log on to our Crisis Lab website. So crisislab.org.nz/EEW. Well, thanks for your time.
So Marian is not here, but I send her our thanks. And, you know, her work again represents kind of different themes in ISCRAM research. First, there's a focus on early warning systems, communication systems, not just for earthquakes, which are more relevant in some contexts than others, but also early warning and public information systems surrounding emergencies that might be more frequent, more related to the works of PSAPs, for example. So I will move now to our third presenter, and I will turn it over to Hugo and Chris.
Hello everyone, my name is Duygu. I'm a PhD student at Virginia Tech. I'm going to briefly talk about 311 non-emergency systems and their role in disaster management, which we are exploring for a while with my advisor, Dr. Chris Sobel. 311 system was initially built to eliminate congestion in 911 emergency system, which was getting a lot of non-emergency calls, and a separate helpline for non-emergency issues helped government to separate true emergencies from the other type of needs. Today, 311 is a well-established public service system, which is available in many metropolitan areas in the United States and Canada. And each of these systems are independently designed, but we can say that 311 systems are responsible for mainly 2 types of requests. The first one is the service request, which need to be performed by a responsible local agency. And some examples could be cleaning up a trash, fixing a street light, or removing a fallen tree. And the second type is the request for information, and citizens may ask about the beginning date of a government program or an operating hours of a particular agency. 311 systems generally provide a broad range of access options for citizens to reach out to this system, including phone, website, chat, or smartphone app, and they also enable multiple language options to make sure that citizens have the ability to contact with the government in any way they want. Another beauty of this system is it has highly structured and standardized data with all the necessary details, including the time and date the issue is created and resolved, its category, geo-coordinates, and resolution status. And some of the 311 systems even put their datasets in open data portals and enable public access to their historical and timely dataset. Although this system doesn't design as an emergency management system, it can play a critical role in helping to manage disasters. For example, this system continuously provides relevant, timely, and up-to-date information to the community, which is extremely important in crisis situations where people always seek reliable and up-to-date information and a real contact for their specific needs and questions. 311 is a way of communicating with the government, and its continuity of service during emergencies provides a sense of stability and support from the government, which reduces the stress and panic in disaster times. 311 can be considered as a multidimensional sensor for situational awareness, since it supports active participation of citizens in disaster management and volunteerism. These people can use 311 to ask about information, maybe evacuation plans, shelter availability, or emergency restrictions. Or they may want to voluntarily report damages in their neighborhoods or violations regarding emergency restrictions. For example, in Orange County and New York City 311 systems, we observed that during COVID-19 pandemic, people have started to report social distancing and face mask covering violations to inform local authorities. So this system provides a great platform for citizens to stay informed and also voluntarily provide additional information to their governments. Additionally, 311 provides a comprehensive and historical data set which allows capturing changing needs and requests of people over time, so we are able to observe the complex reactions and responses to different disaster events. The figure given in the right-hand side just illustrates how daily call volumes for certain categories may severely change during a disaster. This specific example is from COVID-19, and we can see that people have started to ask information about the pandemic and the available relief funds. Access to such a comprehensive dataset supports many analytic approaches, such as forecasting, resilience quantification, and workforce scheduling to support disaster operations management efforts of these governments. These were just some example characteristics of specific 311 systems. We believe that these non-emergency systems have a great potential to support disaster management efforts of governments, which may complement other disaster management systems with its great adaptation and flexibility, and also their continuous information exchange capability with citizens. Thank you so much for your kind attention. Please feel free to contact us if you are interested in more details about these systems, and we will be happy to answer your questions.
Thank you very much. So I have a question. You mentioned that different entities have put their data, made their data openly available. Kind of what, maybe you could speak to what insights that might bring back to the agencies that publish their open data, and maybe the opportunities to compare open data across different sites.
Yes. Actually, there are many 311 systems independently working, and some of them provides their data available as a public data source. And like these are structured data sets and provides both historical and up-to-date information. So I think it provides a lot of opportunity to understand what's going on at the same time in different regions, and like gives a lot of data analysis opportunities as well. Dr. Zobel, would you like to add some more about that?
Sure. Yeah, I think part of it also is transparency. So letting the people in the municipality see what's going on, and many of these systems, you can get that in real time. You can kind of track the resolution of different issues, but by publishing all of the data over the last couple of years, it allows for independent researchers to go in and kind of try to understand the trends. It allows for the city to do similar sorts of things. So I think it just is, it's a part of the culture of many of those local governments that they really want to be, they want to share the data, they want to make it available in order to make sure that the people are confident that the money they're paying in the taxes, et cetera, is being used, and they can see the results of that.
Yeah, very interesting. Yeah, when I asked the question, I was thinking, you know, and you spoke to this, the advantages for the sharing entity, but then as you described, there's, you know, opportunities for the public to look at what what the interactions with these services look like in their community. Okay, yeah, I'll move. I'll just say, do you have any more to add? Sorry, I'm causing problems as a moderator here.
No, not at all. I think it's a really interesting data set in part because it's so highly structured. So we've done, and a lot of people have looked at things like Twitter and Facebook as a source of volunteered information from the community. And that was sort of the perspective that we took in starting to look at this data, is that it's volunteered, but it's within a very specific structure. And it has to do directly with the operations of the whatever community it is that the system is running in. And so from a disaster management standpoint, it's not an emergency system, but it sort of covers everything that underlies that, right? And so there's opportunity to look at how things change over time and to get a good understanding, both for the government and for the people who are trying to understand what's going on. You get this really good baseline of how normal everyday life changes during a disaster, and it just provides opportunity with the very highly structured data to try to build models and so forth to understand and predict a little bit better how to allocate resources in a disaster situation.
Excellent. Chris, thank you very much.
Yeah, thank you.
Yeah, thank you.
Okay, could we move to our next slide, please? So we've seen three great examples of research in the community. They are representative, but also it was difficult, soliciting presentations for this webinar because there was such diverse work. It was hard to find a representative research related to public safety. So because we can only see three presentations, it's a good segue now to talk about how can members of EENA access the broader range of research that comes out of our conferences and the ISCRAM community at large. Next slide, please. And so the best way to do that is to go to our digital library, which is an open access source for all the publications that ISCRAM researchers like the ones we've heard from today, publish each year. And so we have over 1,800 reports in our library, and you can access those using different search fields through our library. Next slide, please. Carolyn, did you have, would you like to address something?
No, there is a question on the chat and I wanted to answer while you were talking, but that's fine.
Okay. I thought you wanted to speak. Okay. Okay, so as the slide shows, here's the interface you'll see with the digital library. And just using simple search terms, look at the types of research that's ongoing in the community. Next slide, please. Okay, so this brings us to our last section, which is how can we bridge connections between ISCRAM researchers and public safety professionals on applied problems of that matter. Next slide, please. Okay, so as I mentioned, the goal of ISCRAM is to be a facilitator, is to work to create these collaborations that cross over from academia to applied practice in industry and among government public safety professionals. Next slide, please. So I'll talk about three opportunities, and these are not the only opportunities, of course, but there are three current opportunities that we're using to jumpstart these collaborations and support them. So first, we invite practitioner papers to our ISCRAM conference. Second, we will have an EENA corner where EENA members present their work and problems that they confront in their work at the ISCRAM Annual Conference. And third, at EENA's annual conference, upcoming conference in Marseille, there's our research corner where ISCRAM researchers present their work on public safety issues. Next slide, please. So first, for our ISCRAM conference, where typically people submit papers and present them for discussion and meet others working on the same issues, we invite practitioners to submit short papers. These can be 500 words in a format that's appropriate for discussing the issue. Because we want practitioners to be able to introduce real-world problems, real-world experiences that they encounter, that they think are relevant and need to be addressed through research-related investigations. And so we invite these papers to the conference. We invite posters, which could be our shorter presentations of these real-world experiences and problems in order to initiate conversations at the conference. And these conversations typically, can highlight problems, opportunities from the practitioner side, and they connect with current research and possible solutions, possible research projects from the researcher side. And so when those two sides connect, interesting opportunities for collaboration emerge. I note in the slide that if you're interested in submitting a short practitioner paper or poster to the upcoming ISCRAM conference, please email Carolyn or myself before March 1st if you'd like to learn more or submit a paper. Next slide, please. You can see the homepage for the upcoming ISCRAM conference in Tarbes, France. It will be held from May 22nd to the 25th. Next slide, please. I'll note also that practitioner papers and posters are solicited from our ISCRAM Asia Pacific conference. If you find yourself in that area of the world or want to be there, please submit a paper or learn more about getting involved with this event too. Next slide, please. Next, I'm really excited that we now have a joint event hosted between ISCRAM and EENA at the EENA Annual Conference. Our first Research Corner event was held in Riga a few months ago, and it allowed researchers to present their work just like we did today in the webinar, and then invite conversation and follow-up conversation at the conference about issues of mutual and overlapping interest between practitioners and researchers. So again, it's the object is the same for the practitioners' papers that I just described. I would say broadly that researchers are looking for insight into problems, opportunities that present opportunities for research, and and practitioners, being the ones who encounter these problems, are of course the authority to point researchers in the right direction, to guide work, to make sure that the outcomes of the research address real-world problems and that are applicable to practice in public safety. Next slide, please. So you'll see here are the presentations that took place at the first Research Corner in Riga, and they range from simulations of emergency call center procedures to managing emergency operations center virtually, different ways of using data to understand emergency response activities historically in order to make better decisions moving forward. Next slide, please. The upcoming Research Corner in Marseille is scheduled for Wednesday on the 27th of April from 4:20 to 5:20. So we hope to see you there. Next slide, please. And at the upcoming Research Corner, we have a few presentations already in the works, and we will have additional speakers. You'll see that the presentations, again, present a range of work, and the goal is to invite discussion and invite collaboration surrounding maybe not these particular issues, but related issues that practitioners bring to researchers. Next slide, please. So we are here at the end. I would thank you very much for your attention, for your attendance today, and also thank you very much to our EENA hosts for inviting us to present and talk about ISCRAM at today's webinar. I would like to open it up for any questions that you might have, and hope to hear more from you either at the Research Corner event at EENA's upcoming conference or the ISCRAM conference in Tarbes in May. Thank you again.
Thank you very much, Rob, for to all the panelists for very great presentations, examples of research conducted in the public safety sector. Here we had some questions running together with the webinar, and you answered them very, very nicely, either through the chat. So thank you, Caroline. Thank you, all the panelists, for being so attentive. I don't see any other questions in the chat or Q&A window. So if there's nothing else to mention, or maybe some remarks from the panelists or observations, but if not, then I would just like to have 1 second to go through some practicalities. Feel free, Caroline, to say something.
Yeah, I don't know, Rob, we haven't mentioned the EENA panel in ISCRAM. We are still working on it with Benoit, but maybe we can say some words about it.
Sure, yes. So I mentioned the Research Corner event at the EENA Annual Conference. So in addition to our opportunities for practitioner papers and posters, we will kind of have a similar event, let's call it EENA Corner, at the ISCRAM conference, where we are inviting public safety practitioners, professionals who would like to speak about their experiences, talk about current issues in public safety, to a full group of ISCRAM researchers. And it would be an excellent opportunity to hear about current issues in public safety and initiate research on those topics by connecting with researchers at the ISCRAM conference in Tarbes in May.
I actually got one question, and here I just read it out loud, if you don't mind. So how end users can contribute to improving the usability of disaster apps?
Very good question. Users of disaster apps. So this is a good question because, you know, our previous presenter, Marian Tan, her prior work focused on disaster apps and the usability of disaster apps. So I'll point the question in her direction if you want a better answer than mine. However, my initial response is that you know, the first case is there's a variety and expanding array of apps now. You know, there's an app for anything, right? Including whatever emergency you happen to encounter. The opportunities for end users, if by end users means some sort of, especially if it's like a public safety professional impacted by the use of the app, I would say the best one way is to kind of use the opportunities that I issued here. You know, for example, if you email Carolyn and I about a poster or practitioner papers, or just said, I'm interested in, you know, learning more, contributing to the usability of apps, we could reach out to our network of researchers who we know are working on these issues. You know, one thing that ISCRAM's good at, and I think most ISCRAM members would agree, is that these types of problems, for example, the usability of an app, really requires collaboration from different stakeholders, you know, end users, developers, different public safety professionals who are impacted in different ways by the deployment and use of these apps. And so researchers then take on the role of a facilitator, trying to bring these stakeholders together and structuring a project in order to highlight issues of usability and co-design solutions that address them.
Perfect. Okay. Thank you very much, Rob. Thank you very much, Caroline, Anouk, Dogu, Chris, Ophélie, for great presentations, for your presence today during our webinar. It was very nice to get to know ISCRAM, its activities, its events, the scope of research. And I think that here we can just quickly move to one or two practical slides. The first important thing to know is that tomorrow you will have the recording of this webinar available on our webpage together with the presentation delivered today by our panelists. If you encountered any issues, technical issues, or you have some suggestions, just feel free to send me an email. We are always into improving our webinars. For more information, go on our Knowledge Hub/webinars webpage. Of course, thank you. If we can move to the next slide. Rob already mentioned our upcoming event, EENA Conference, where we'll be welcoming the session of Research Corner together, thanks to ISCRAM. So thank you very much for notifying the hours. We are really looking forward for the presentations. And the last slide, just to mention that we have the upcoming webinar on dealing with the unexpected that is planned for 28th of March. More info will be available soon. So stay tuned. We will update our webpage with the speakers who will deliver amazing answers to, for example, how can a public safety answering point prepare for events, unexpected events that they are not ready for example. So more to come. But first and last thing to say, of course, a big thank you to our panelists of today. And thank you very much to our participants who joined us to listen to the presentation of ISCRAM. And I'm looking forward to see you in 1 month for the next webinar, and of course in Marseille in April. Thank you very much. Stay safe. Bye-bye.
Thanks. Bye.